Hi, everyone. How are you this beautiful Friday afternoon now? And we don't have much to update you on. We're commenting on the fact that we've been up and running as a emergency operations center now for 3 months. And what a transformation has taken place over these last 3 months from where we were to where we are. And just so proud of this organization, all the elected officials, all the police chiefs, all the city managers, all the fire chiefs, everyone in the leadership role here in this county. Well, really worked in concert to get us through this crisis. And as you all have received by now, there is new orders that have come out and will take effect. One today on the beaches, and then more on Monday in regard to stores and churches. So it is, we are getting there, and we're getting there together. Really, a city, a county actually working really in concert. Everyone rowing in the same direction is just so heartening to see that, and so many good people step forward through this crisis. So just wanted to throw that out there as we really end our 3rd month here. So as far as the stats go, we're at just over 2,000 now who have tested positive in the county, 2,061. Thursday we had a plus 59, and Friday plus 39. So that is an indication of obviously more testing. And again, these are the best numbers that we're going to see. As we start to open, we expect these numbers to change. And the whole trick is, and the whole balance is, making sure that we have the capacity to deal with these cases while opening gradually. And that's what Dr. Morrow is trying to do here, is really balance that spread of the disease and our resources against the financial devastation that is taking place out there. So you can see from the stats, I don't know if you can pull them up, or I can just talk about them. We've got 41 in the hospital today, and that allows for 51% of our ICU beds to be filled, with 49% available, and 19 of those 41 are COVID related. But the good news is we're starting to see, at least over the last day or two, the numbers come down, and it'll be interesting to watch those hospitalizations as things open up more. And we just want to again emphasize that we're late in the game, but this game's not over by any stretch of the imagination here. That we have got to continue the diligence that has really taken hold in this county as far as social distancing and face coverings, because we need to see those numbers come down. The hospitalization numbers continue to come down in order to move through the various phases. So we've got over 32,000 tested in the county right now. The positivity ratio is coming down and will continue to come down, we hope, to 6.4, which is a good sign. And the turnaround of test results is really looking good, 1.7, considering the amount that we have jumped. We're still continuing to try to expand capacity in this county. We talked about last week trying to get out and do a beta test in Pescadero. So that'll take place tomorrow, or today and tomorrow, that we're doing that. So we're excited about that, to see how that turns out, to see if we can do things differently. And we're also have our legislative committee from this county, along with Congressman Spear, trying to work on more capacity building from the state down through the county through Verily. So we'd love to see Verily expand. They are willing. It's going to take state authorization, and hopefully we'll get there at some point in time. So just a quick update on the guests, as I usually do. At our health facilities, we have 5 at the COVID-19 hotel in Burlingame. We have 2 at the event center. Good to see that number coming down. And then certainly at our homeless shelter, Bayfront Station, we have all the rooms filled there. But we're getting through most of those on the list, on the waiting list for that are homeless. We're down to 10, we believe, and we're looking to really kind of fill that gap next week. So hopefully we won't be adding to that, but subtracting from that next week. Just news, additional news is in addition to you all getting the the new orders, and we've got certainly our one of our favorite attorneys, David Silverman, on the phone here, who's certainly able and willing to answer any questions you may have. So I'll leave that up to you. But the only other news we have is obviously we put out a news release regarding the county budget, which is now published. It is really a pro forma budget. It was really something that had taken place before COVID. We don't know the full impacts of this COVID disease on the economic stability of the county and what that means to the county going forward. But I can tell you that we are looking at a deficit that we will need to correct in the September revisions of $65 to $100 million. So, and that is based on the numbers that the state has given us in regard to the impact to sales tax and realignment funds and our Prop 172 funds, which coincidentally and unfortunately, really support the things we need most in this county, which is, along the public safety lines, law enforcement, and certainly our health system and safety net services. So we'll be working on that to get that together, and for September revisions, we've got a plan in place, and more to come on that as we address the board. With that, that's really all I have. Let's see if there's any questions.
We'll give it a minute. Yep, we do have one from John Mays. If you would like to unmute yourself.
John, how are you?
Good. How are you?
Good.
Good. So I have one, maybe two questions on the budget, and then a few more on the orders. Which one do you want first?
Why don't you pick since it's Friday?
Okay. I'll do the budget. Got the press release. It's well written. Whoever wrote that, you should keep them around. One question. One question I had, 65 to 100 million as far as the shortfall, and then 57 million for county health. Is that on top of, or is that separate?
That's separate.
Separate. So it's 65, and in addition to that, 65 to 100, and also 57 million for county health.
Yeah, and we're really haven't really fully realized all the impacts to health, really, because of this COVID virus. We know that there was projections in there to reach certain revenue levels that were necessary to try to close that gap. Obviously, that is not going to be the case given what has transpired here. So that was $57 million structural deficit in that budget prior to COVID. So that is something that we still have to look at, and we still don't know, if that is grown substantially. But it's something that we will certainly be looking at.
Okay. So how much, and also in the release, it mentions that there's, the county's looking to get some of the money back for the financial impact. How much, is there an estimate of how much federal or FEMA money, emergency money might be coming to the county, and how much the county's looking for?
Well, I can tell you, we just, yeah, absolutely. We're looking for about 64 million, which we would get 75% of, which from FEMA. So that's FEMA reimbursable. And we've been approved for that amount. Now they will give you 50% of that up front as you claim it. And they just dropped that down to 40%. So all these numbers I know are very confusing, but I think that what you're after is we have received about 18 million, almost 19 million from FEMA back. We probably spent close to $100 million on COVID-related cases. So that which is not picked up by FEMA, we're claiming in the CARES Act. So we do have money on hand to take care of that additional sum that we're not getting back from FEMA. So, in long story short, is we hope to not put any general fund in this. We're hoping that the state and federal government will take care of us and make us whole, because we've got quite a deficit without the COVID crisis cost on top of it.
Great. Next question is from Henrietta. You've been.
Wait, I think John had some more questions related to. John, do you have more questions related to the orders?
John, you'll need to unmute yourself again.
I do. So I can let others and then come back if that's okay, or I could just continue now if that works for you.
Yeah, please continue. That's fine.
Okay. So just to clarify, you're hoping that you've spent 100 million on COVID and hope to get most of that back, either from FEMA or through the CARES Act. So
Right.
this 65 to 100 million is just from reduced tax revenue and that type of thing. And so that's just that's not going to be reimbursable.
That's right. That's the projected.
Okay.
That's the projected deficit as we sit here now. And the reason we're taking care of this in September revisions is we'll have a lot better idea in July and August what the actual numbers are as it relates to the sales tax deficit.
Right. Okay. Okay. Thanks for that. And then, so I see in the order that everyone can go to the beach. Obviously, there's some concern about, you still have to be careful, social distancing. It's not an open invitation for everyone to go, but people are going to be allowed to. I'm wondering if the changes to access to the beach is it similar to what will be happening at the parks? Can you park on Skyline now as well? Is there going to be restrictions at the other parks continuing?
Let me preface this by saying that still the shelter in place order is still in effect, and we're imploring people not to go to the beach. But
Right.
for those who
I got
go
it.
to the beach, for those who do go to the beach, the parking lots will be open, the restrooms will be open. We hope that they adhere to social distancing and certainly wearing face masks when appropriate. And they really space out from each other. The beaches are large, and to the extent that they want to walk on the beach, just stay away from each other, and just really good, and just use really good common sense. What I guess what we're really concerned about is the stores and streets of Half Moon Bay, Pacifica being inundated with folks, and that would just be untenable. And that's how numbers start to jump very quickly. So we're hoping that won't be the case. But it didn't make any sense. People were coming to the beach. It didn't make any sense to keep the parking lots closed still. These hours were not being adhered to, and there just isn't enough personnel to really go out there and enforce those hours. So we're being practical, and we're again, relying on the social contract of folks to understand that this disease is still extremely prevalent. The numbers don't lie. We can tell you how many folks in this county are getting it on a daily basis. You can see those numbers are still significant, and we're just asking people to use common sense here.
Okay. So still restrictions on Skyline as far as parking. I know that there's there's lots available for some of the open space preserves, and Skyline parking was prohibited. Is that still the case?
Well, those are state parks, right? That you're referring to?
State parks and mid-pen open space preserves.
Yeah, I'm sure.
I'm sorry, Mike.
Dave,
So just to clarify, those closures are not an order issue. In fact, none of the parking closures were an order issue. The order restricted, the prior order restricted when you could travel to the beach, like the timing that you could travel to the beach. And the prior order limited what you could bring onto the beach. But as far as parking, that was a decision that the various authorities that controlled that parking made. And it's the same thing with parking now. All entities that control a recreation area are required to do what it takes in order to make sure that the facilities that they manage are managed in a way that complies with social distancing requirements and reduces crowding. That hasn't changed. That's always been the case, but it's up to those individual jurisdictions to decide how to achieve those goals. So I can't speak to the particular locations you're describing, but it's not the order that requires those parking places to be closed unless those jurisdictions decided that's what they needed to do in order to keep people safe, in which case we obviously should respect that.
Okay, thanks for that clarification. I appreciate it. One more question on the order. So with gatherings of children or summer camps went from 4 weeks to 3 weeks. A lot of these camps are just now figuring out how to get to 4 weeks. Now they have 3 weeks. Any chance of getting to 2 weeks, or what are the conditions that might have to be met for that as we head into the summer? I know a lot of the camps are are struggling real hard to figure this out. A lot of the parents are as well. Any guidance on that would be appreciated.
So, I mean, I don't want to refuse to answer a question that I have some information on. That's really more of a question for the health officer. What I can say is that the 4-week time period was selected by the health officers in consultation with each other regarding what they thought was an appropriate stable group. Because of course, the more that kids move between groups, the more opportunities for cross exposure, right? And so more recently, the health officers, got together and, they concluded that 3 weeks would probably also be okay. It's also a recognition, I think, of some practicalities, that folks were struggling with the 4 weeks, that some summer school funding is for 3 weeks. None of this stuff is safe. I mean, everything we do that increases exposure puts people at risk. And so it's not an issue of conditions changing. Again, this is really a question for the health officer. And I can't say that it won't be reduced, but this was something that the health officers thought out, and it's a metric that they chose that they thought was appropriate. I mean, I think that's the best I can do.
Okay, thank you.
That's it, John?
That's it.
All right. Any other questions?
Yes, now Henrietta, go ahead and ask your question.
Yes, thanks so much. I haven't had a chance to do any research on this, and I'm wondering what information you might have. But it's my understanding that some families have sued nursing homes and senior care facilities over the deaths of their relatives because of COVID-19. And Governor Cuomo has passed legislation releasing these facilities from liability, and it's my understanding that Governor Newsom is considering it. Do you have any knowledge of this, and what might your opinion be on any waivers of liability?
Henry, I have no knowledge on this whatsoever, and I wouldn't opine on it either. It's really kind of out of my ballpark area. But David, I don't know if you have any information on what the governor's doing.
I haven't heard any. I mean, I try and track this stuff as closely as I can, and I'm sure that Ms. Burrows saw it. It happened, but I haven't seen anything like that.
Thank you. I'll do more research myself. Thank you.
Great. Thank you for the question, though. Anything else?
At this time, there are no other raised hands and no chat questions.
Wonderful. Thank you all. Have a wonderful weekend. Stay safe, stay healthy, and we will see you back next Wednesday. Take care.
Thank you.